Lupus is hard to describe.
How would I describe lupus?
A internal war with your own body.
Do you feel like you have been hit by a Mack truck?
Lupus feels like someone smacked you in the face.
You know, they're like, you don't look like you have lupus.
People don't realize that it's painful, physically and mentally.
Lupus is like the bully at school that you always try to avoid, but it always finds you, beats you up, and takes something away. Your friends, your energy, or even your ability to do simple things.
It's unpredictable and hard for others to see.
It's like waking up every morning to your own personal game of the lupus lottery.
You now have chronic pain, extreme fatigue, and kidney failure.
It's hard to understand.
Lupus is hard to wrap your head around.
The simplest way I can describe it is
the never-ending flu.
Lupus is a chronic autoimmune condition where your immune system starts to attack self. In lupus, that attack can be on any organ system in the body, which makes it difficult to diagnose. It's a chronic disease. There's no cure. It tends to target women between the ages of 15 and 45, and women of color are 4 times more likely to develop lupus.
It's hard to live with.
Imagine driving a car, but your taillights are out, your tires are going flat, your parking brake is engaged, you're leaking fuel, but yet you still have to figure out how to merge onto this interstate at a high speed. You have to still do it. That's what living with lupus is like.
It's hard to treat.
Lupus feels like you are in a boxing match and you are blindfolded with your hands tied behind your back and you're supposed to fight. How can you fight?
It's difficult to diagnose because every patient can look a little differently. There is no cure for lupus, but there are medications out there that can help treat the disease.
Lupus is hard,
But you're not alone.
I get answers I need on lupus.org.
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 Good afternoon, everyone, and welcome to another interactive session of the Lupus Society of Trinidad and Tobago. I understand that we have some new members, so just to give you a little background on the Lupus Society, the society was formed way back in 1988. The person who remained as president longest is Mr. Curtis Wilson, God rest his soul. And Dr. David Quamina was our patron in those days. We've come a long way. Some of you may remember the little room we had next door to the skin clinic, which is no more. But time moves on, and hopefully we'll get to that position again where we have our own space to call home. But meanwhile, I invite you to participate in this afternoon's meeting, and I hope that you get as much of it out of it as you can. I would like to take a little time to introduce our guest speaker today, who is Dr. Sandra Reid. Dr. Reid is a consultant psychiatrist, and she has more than 30 years under her belt in public and private practice. She's a graduate of the University of the West Indies, where she did her undergraduate degree as well as her postgraduate psychiatry. She has a master's in public health from Johns Hopkins University. She's the Deputy Dean of Clinical Programs at the Faculty of Medical Sciences of the UWI here at St. Augustine. And she tells me this is what is occupying most of her time these days. She's also a senior lecturer in psychiatry at the University of the West Indies. She is the director of the Caribbean Institute on Addictive Disorders. I think she has a lot to share with you. I'm sure that a lot of you will understand why this is an important topic, and I know there will be lots of take-home points. So I welcome Dr. Sandra Reid.
This is for the busted hearts. This is for the question marks. This is for the outcast soul, lost control, no one knows. Sing it for the can't go back. Sing it for the broken past. Sing it for the just found out. Life is now upside down. If you're looking for hope tonight, raise your hand. If you feel alone and don't understand, if you're fighting the fight of your life, then stand. We're gonna make it through this hand in hand. And if we fall, we will fall together.
This is for the second chance. This is for the new romance. Singing for the left in vain. Overcame. It's not too late.
If you're looking for hope tonight, raise your hand. If you feel alone and don't understand, if you're fighting the fight of your life, then stand. We're gonna make it through this hand in hand. And if we fall, we together with our differences. Together we are bolder, braver, stronger.
So I was a little bit ahead of myself there. And thanks to Clifford for organizing all of this lovely video and audio for us. So I do believe that Dr. Reid may be ready now. Yes, there she is.
Yes. All right. Okay, so thank you, Dr. Sweet, for your introduction, and good afternoon to you. Good afternoon to Mr. Balgobin and all of the members and supporters of the Lupus Society of Trinidad and Tobago. It is my pleasure to be here with you this afternoon. When Mr. Balgobin and Dr. Sweet approached me about the topic of mental health and lupus, I immediately agreed because of how commonly mental health symptoms tend to occur in persons with SLE. I don't know if the topic has been previously discussed, but I do know that it's a very important one, and yet one that can very easily be overlooked. As I listened to the introductory video, the comments that were made by the individuals who were experiencing lupus, whether they were actors or real persons, it seemed to me like they were real persons who had the disease. It spoke to the challenges, the many challenges involved with being diagnosed with a chronic medical illness, and especially the illness of SLE. I understand that these sessions are very interactive. I know that not many people are on as yet. We hope that more will join. But for those who are on, I look forward to your sharing and discussing, because when we have sessions like these, especially when we discuss topics that are not commonly discussed, there's a lot of learning that takes place in both directions. And I do look forward to you sharing and interacting this afternoon. So we're going to go straight into it. So there is no increased rate of mental illness per se among persons diagnosed with lupus. It's not as if they are more likely to become schizophrenic or bipolar or anything like that. But it is quite common for patients with lupus to experience some of the more common psychological symptoms like depression and anxiety. And one study actually documented a higher rate of psychiatric symptoms, not illness, but psychiatric symptoms among persons diagnosed with lupus than among the general population. So there is recorded evidence that the rate of psychological symptoms is very high among this population. In this presentation, we are going to be using a lot of terms that people talk about very commonly. Mental health, depression, anxiety, those are words that we hear over and over again. And especially in these pandemic times, we have been hearing a lot about those words. So I think that a good place for us to start this afternoon is to look at some definitions to ensure that when we are using the words in this session, we are all on the same page. So one of the first things we want to establish is what we mean when we say mental health. We're talking about lupus and mental health. And for the purpose of our discussion this afternoon, we're going to define good mental health as the ability to cope with life and its stresses without experiencing psychological symptoms and stress-related physical symptoms that prevent us from functioning optimally and being the most productive that we can be. I want you to note three things about this definition. First of all, it would be very, very apparent that mental health has a lot to do with how you cope. That's one. Secondly, we should note that poor mental health can have psychological symptoms, but you can also get physical symptoms as part of poor coping and poor mental health. And that presents quite a challenge, not just with lupus, but with many of the chronic medical conditions where the physical symptoms of the illness are almost identical to the stress-related physical symptoms that can occur. So it's important for us to keep that in mind. And when we talk about mental health and poor coping, there can be psychological symptoms or, and I call it stress-related physical symptoms to distinguish it from the physical symptoms of the lupus itself. And then the third thing in that definition, and I hope that you picked it up, is that it's actually okay to have psychological symptoms once they do not impair our quality of life, prevent us from functioning optimally, and prevent us from being the most productive that we can be. So we don't want to think that we're going to go through life coping with a chronic medical illness and have no emotional response. That's not realistic, all right? So what we're looking at is coping where when we experience these responses, they do not impair our quality of life. So sticking with the definitions, we want to talk some more about some of those specific psychological symptoms and clear up the difference between some similar terms. So first we want to look at sadness or depression, right? I wish, anytime you're ready to throw a comment in the chat, please do, because normally if we were in a different kind of setting, I would be asking you, what's the difference between sadness or depression? But you can see on the slide there that when I speak about sadness this afternoon, I'm talking about a normal human emotion. If anybody told me they never felt sad, I would have to do a psychiatric evaluation because it's a normal emotion and things happen in life and we all feel sad. And it's important that we should be able to recognize when we are sad and acknowledge that feeling. You know, sometimes you get an emotion and the tendency is to try to block out that emotion, to suppress that emotion. And I know that lupus is a lot more common in females. And we handle this through expressing it, and it can be expressed like sadness, so we cry, right? Or it could be expressed through recording the emotion, and that's why something like a journal and keeping a record of emotional responses is important and useful, because you don't have to always express an emotion in an emotional manner. Sadness can be expressed by writing in a journal. And any emotion can also be expressed indirectly. Anybody who exercises regularly can know that. You're angry, you're frustrated, you're sad, you go, you exercise, you feel better. So the emotions can be expressed in that way as well. Now that sadness is to be distinguished from depression. Some people use the terms interchangeably. This afternoon, when we speak about depression, we're talking about a sustained sadness, a sadness that lasts for a longer period of time, 2 weeks or more. And with it comes other symptoms. You lose your appetite, or you start to eat more than usual. You sleep more, sleepy all the time, sleep away the sorrows, or you find that you have insomnia, you can't sleep, you can't focus, and you are consumed by negative thoughts, hopeless thoughts, even thoughts of suicide sometimes, but the thoughts are all very pessimistic. And as I said, that goes on. That's not like the what I call the normal sadness, where you could bounce back out of it, or a good friend calls you and you have a good laugh and you feel good again. This depression is much more, the intensity of it is greater. And significantly, it impairs one's functioning. Similarly, we could look at concern versus anxiety. And when we talk about concern, it's very normal to be concerned. You're diagnosed with lupus, it's normal to be concerned. Your medication dosage has to be changed, it's normal to be concerned. You're getting new symptoms, normal to be concerned. So that's a normal response to when things go wrong. It tends to result in the person feeling anxious, and we can identify with feelings of being tense and worried. But in the normal situation, that anxiety should motivate us to seek solutions. When instead the anxiety is sustained and you start to get a whole range of symptoms, so you start to feel fearful and on edge, agitated, restless, when the fatigue is ongoing and the concentration is poor in a prolonged way, you get irritable, muscles are tense, trouble sleeping. That is a different situation. That is an anxiety that requires an intervention. Okay, so I hope that you're with me so far. So when we talk about concern, that's normal. We talk about anxiety, it means that this is something we need to do something about. Another term that we will be using this afternoon is coping. I think that one is pretty straightforward, but I have a slide there nonetheless. Coping is the process by which a person consciously attempts to deal with stresses and problems in life and the normal feelings of sadness and anxiety that occur. So we're going about, life is never smooth. Encounter stresses, feel sad, feel anxious, feel frustrated, discouraged. We have to consciously decide that we are going to cope with those feelings. And coping behaviors can be healthy or unhealthy. How do we make the difference, the distinction? Healthy coping, all is well. Unhealthy coping usually results in more problems. And even as I speak, I hope that you'll be thinking about what do you do? How do you cope? Do you cope in a healthy manner, or do you sometimes resort to unhealthy coping? So let's talk about lupus now. So systemic lupus erythematosus, that's the long name, or SLE or lupus, can result in any of those mental health symptoms that we just spoke about. Interestingly, there is more than one way in which lupus can lead to mental health symptoms. And that can make it quite a challenge when a physician is trying to discover the source of these mental health symptoms. But we're going to look at all the possible ways. There are three common ways that lupus can lead to mental health symptoms. And the first one, it can be triggered by the physical symptoms of the disease itself. So if we could get that slide on, that would be good. All right, so while we await the slide, I'm going to share with you two syndromes that can be caused by the lupus disease process itself. The first one is called lupus brain fog. You might have heard of it. Even if you haven't heard of it, I suspect you might have experienced it, since reports state that about 80% of persons with lupus can experience this at some point in time. This lupus brain fog can occur during a flare-up. It is characterized by forgetfulness, difficulty thinking and expressing oneself, problems with concentration, problems with memory, feeling confused, and with that you can get a feeling of depression, and you can get headaches and a feeling of fatigue. I wish I could see some hands or see some points to see if anybody could identify with that. Let me see. No, there's nothing in the chat, nothing in there, right? But the ability to engage in your normal day-to-day activities, the ability to plan, the ability to multitask are affected. So you can imagine that this brain fog affects your ability to work or to do your daily task. What can one do when they experience such a lupus brain fog? Well, because it is caused by the illness itself, the treatment is really to manage the flare. Manage the flare up. So you're talking to your physician. He or she would recommend to you what is required to manage your condition at that point in time. And once you become stable again, the symptoms of the flare up tend to go away. Other things that you can do for yourself and that tend to reduce the risk of such a flare-up, things like managing your weight. There is that connection between being overweight and having these brain fog experiences. So weight management, exercise, getting adequate sleep, not using alcohol or tobacco, those are ways that you can minimize your risk of having this lupus brain fog. But once it occurs, there are also things you can do. You have to, basically you're learning to function with the symptoms. So you want to stay as organized as possible. If your brain is not working as it should, you want to write things down. You might want to engage in some memory exercises. If you know that the challenge is to multitask, then don't try to multitask. Organize your tasks for the day in such a way that you do your harder tasks earlier in the day, those things that require more focus, more attention, more concentration. Put those earlier in the day so that as the day progresses and you feel more tired and you feel more cognitively challenged, you have your easier task towards the end of the day. So that's one way in which you can experience psychological symptoms as a direct result of the illness. And I said there was a second syndrome, and this one is a little more serious. This is what we call neuropsychiatric lupus. It's called NPSLE, neuropsychiatric systemic lupus erythematosus. In fact, it is not uncommon for patients to present to us, the psychiatrists, with what looks like a psychiatric problem, when what it really is the first symptom or the first presentation of SLE. That is why it is so crucially important for psychiatrists to fully evaluate our patients who present with mental health symptoms for the very first time, to ensure that these symptoms are not being caused by some other medical condition. In particular, NPSLE can present as an acute psychotic breakdown. And an acute psychotic breakdown represents a loss, you lose touch with reality. So you begin to hallucinate, the person may become paranoid, they exist in their own world. Even the things that they say, the speech can sometimes appear not to make any sense because there is that break with reality. And it may not be a psychotic illness like schizophrenia. It may in fact be neuropsychiatric lupus, which may be the first presentation of lupus. Now, NPSLE is due to underlying neurotoxic effects. The exact cause of it is unknown, but it may be related to some kind of antibody-mediated neurotoxicity or the effect on the blood vessels due to antiphospholipid antibodies, or it might even be related to cytokine-induced neurotoxicity. No one is sure. But what we do know is that it can occur. It occurs in about 56% of patients is the estimate, right? But when it occurs, most times you get pure neurological symptoms, the commonest one being headache. You can also get seizures, you can get strokes or transient ischemic attacks, TIAs. Of course, I wouldn't want you to go away thinking that every headache you have is NPSLE. Common things are common. And the average headache will not be this condition. But remember, this is a part of the lupus illness itself. So other symptoms of lupus will be there, and medical investigations will provide evidence of active illness. So you can know whether this is a neuropsychiatric syndrome or whether you're just having a headache because of too much Sahara dust and your sinuses were irritated. When
Doctor,
yeah.
I'm sorry. One of our lupus patients says, I think you mentioned before, but she also said that there are times when thinking becomes very difficult.
Yes, yes. And that is part of the brain fog, and it would have been so nice to be able to hear a little more, because we want to know, so when this happens, how long does it last? And this is usually associated with a flare-up. But we know that it happens where thinking can become very difficult. And that can actually drain your energy, it makes you tired. So you get that mental fatigue, and then you get the accompanying physical fatigue because it makes your day-to-day existence so difficult. So I thank you for sharing that, okay? Now, when we look at the psychiatric effects of this NPSLE, what we find is that the commonest syndrome that tends to occur is depression, right? Most times it is a depression. But go back to our definition now. So when we talk about depression here, we're not talking sadness. This is not just a sad response. This is a depression where the sadness persists for weeks, where it's accompanied by all kinds of other symptoms that can affect your sleep, your appetite, your energy level, okay? And that usually requires some kind of intervention, whether it's counseling or whether it's medication. You can get other psychiatric syndromes as well. So we have seen persons who present manic. Don't know if you're familiar with an acute mania. You can ask me questions on it afterwards, but patients present with mania, anxiety. We talked about the psychosis already. And I say again, because it is a part of the lupus illness itself, the treatment is really to treat the lupus, and you can use your doctors would recommend immunosuppressive therapy, and with that, the psychiatric symptoms tend to go away. All right? So that's the first way that lupus can cause mental health symptoms as part of the illness through either the brain fog or the neuropsychiatric syndromes.
Sorry to disturb.
No, that's fine. I want the questions.
So that means our lupus patients, if they behave that way, they're not mad.
Correct. They're not mad at all. As a matter of fact, Mr. Balgobin, I would like to say to you that no patients are mad.
That's a good clarity.
I always tell people I don't treat mad people or mad patients, because we accept that psychiatric symptoms, psychiatric illnesses are illnesses like any other. They are chronic illnesses too. And our patients have similar experiences to the experiences of persons with chronic medical illness or chronic non-psychiatric illness, right? And I'm glad, Clifford, that you kind of brought that one in, because when I was thinking of this presentation, I said, I have to be so careful, because when we're talking about mental health and lupus, and we're talking about how common mental health symptoms are, we never want to communicate the impression that people with lupus are more prone to be mad or to become mentally ill. No, that's not correct at all. But they do have many more challenges coping with life than somebody who didn't have lupus. Okay? So
thank you for that clarity, Dr. Reid. So considering mood swings, how does that come in with the side effects, the mood swings part?
Come in with the side effects of, well, if you have a neuropsychiatric syndrome that affects your mood, then you can get mood swings. So the mood swings can go, when we talk about swinging, think of a pendulum, right? Pendulum swings. On the one end, you have sadness and irritability. On the other end, you have elation, being very, very happy. So you find that people tend to be, we might call it oversensitive or overreactive, because their moods change very quickly, sometimes without a trigger or stimulus, or sometimes with very, very minor stimuli. So you might make a joke with somebody, and ordinarily they take that joke and they're okay. When you're having mood swings, that joke can make a person snap into anger or have some kind of outburst, right? Now you mentioned the mood swings, and I was going to go on to the second way that lupus can present with mental health symptoms, and that is through side effects of the steroid medication. And that is commonly associated with mood swings, especially when the dosage of the medication tends to be on the higher range. So when you are on steroids, higher dose steroids, it is possible to become depressed as a side effect of the steroids. You can get panic attacks, resulting in a panic disorder. We talked about the mania. That's when you get hyper, very talkative, a lot of energy. You become grandiose. You think that you could conquer the world. You could take on anything, but it's in the presence of an impaired judgment. So you make decisions that are not so wise. So you feel like you could start a business. You withdraw all your money from the bank, but it's a business without a good plan, because the mania interferes with your judgment as well. You can become psychotic as a result of high doses of steroids, the emotional instability, and the mood swings that Mr. Balgobin was just asking about. All of those can occur with higher doses of steroids. So you could understand the kind of dilemma that might be presented there, because you may need a certain dosage of steroids for your lupus control. And if that dosage happens to cause these mental health symptoms, your physician has to make a decision reduce the dose because you can't stay with the psychiatric symptoms. And if you reduce the dose, what's going to happen with the lupus? So that is where on some occasions we use psychiatric medication to help manage the symptoms of the psychiatric presentation so that you can continue to be on the steroids because these are needed for the management of the lupus. Okay? So are we good there, Mr. Balgobin? Yeah?
Yes, certainly. So I really asked that question for the spouses and the caretakers of those of lupus patients because the spouses or the loved ones of the lupus patients may pass judgment quickly.
That's correct.
And diagnose, think that they are like, you are a psychiatrist.
Yes. Yes. Although there may be times they need a psychiatrist, as we go along, we'll see that. But it's very important for a proper evaluation to see exactly what is the underlying cause of these mental health symptoms.
Yes, and mental health is very important for times like these now. Very, very important.
That's correct. Because people are dealing not just with chronic medical illnesses, they're dealing with the normal run-of-the-mill day-to-day stresses, and then they're dealing with COVID-19. And if you belong to a subgroup of persons, and this subgroup is the group of persons with chronic medical illnesses, the risk of COVID is greater. And you keep hearing that in the media all the time, who is getting COVID? There was a time they always used to say underlying medical conditions, diabetic, hypertensive. That can be very stressful knowing that you belong to this high-risk group. So the number of stresses that a person is challenged to deal with all at once has really skyrocketed in the last year and a half or so. Yeah? And one really must learn how to cope with these stresses and how to handle in a healthy manner. So that takes us to the next route through which mental health symptoms can occur with lupus. And this is by far the commonest route or the commonest reason that persons with lupus experience mental health symptoms. And that is in response to a reaction to the illness and living with a chronic illness. And this is where I really, really would love to have some discussion. I don't know how many people we have tuned in, but I would love for people to share. Because whether you have recently been diagnosed with lupus or whether you've been living with it for several years, it is very, very likely that you would have experienced feelings of grief, feelings of fear, feelings of anxiety or depression. And this is not unique to lupus. It occurs in most, if not all, chronic disorders, right? So let's see if we can get some interaction there in the chat.
Yeah, so we are asking our viewers or listeners to post your questions or your comments on the WhatsApp.
Questions, comments, and we'd also like to hear what have been some of your most difficult stresses and what has been your experience with mental health symptoms. Have you been having them, or you're not identifying with this at all? What are some of the bigger challenges that you have found in coping with your illness?
Yes, folks, we have our doctor live here. Great opportunity. And let's take it and let's interact with her. She's willing to answer your questions. And by the way, she can answer all your questions, either yes, no, or maybe.
All right. Nothing, not saying anything. All right. That's okay. I made a list. A list is it best comes from somebody who's had the experience, right? But sometimes knowledge is enough. So I made a list. And again, I would be interested to know if it fits the experiences of others or if, my list is purely theoretical. But I would think that one of the biggest challenges associated with lupus is what you lose, your losses. Loss is a very stressful experience unless you lose something bad, right? But when you lose, that's actually ranked high up on any scale of when you're measuring stress, right, and severity of stress. And when a diagnosis of lupus is made, and as you continue to live with lupus, you lose a lot of things. You lose your health, maybe you lose your ability to work, and if that happens, then you're losing your financial resources. Some people actually lose social support because the illness is a chronic illness. And as we alluded to just now, sometimes the people around you don't understand what you are experiencing. And you lose your social support. Sometimes you lose your entire sense of self. And I have actually interacted with patients who your life became lupus. You lost life and everything was about lupus. Symptoms of lupus, medication related to lupus, side effects of medication. And that can be very, very stressful. From the time of diagnosis to living with lupus, there are just so many adjustments that have to be made. And group sessions are good, but one would recognize that for each person, the experience is totally unique. It depends on your experience of the lupus itself. It depends on the course of your illness. Some people have few flare-ups. Some people are ill very frequently. And of course, it will also depend on your own personality. So it is therefore not surprising that there will be a wide range of emotional responses, from normal responses of sadness and concern to unhealthy responses. And the feelings can range from shock and disbelief to sadness, anger, fear, anxiety, even blaming oneself or others for the diagnosis. So emotions really can overtake you at the time of diagnosis of lupus and even as you continue to live with the illness. Now, the disease or the treatment of the disease may make it necessary for you to cut back at work. We talked about that, so that's a loss too, or even leave your job. And this can affect the pleasure that you get from your job. It can affect your whole sense of purpose and your income. So this whole idea of loss is something that can be very stressful when coping with lupus. Is that a question there?
Yes. I think it's a comment. It says,
yes. Mm-hmm.
I have been diagnosed over 27 years. Oh my, that's a lot of years. From time to time, there were anxiety whereby medication was prescribed. The medication and the weight gain was not comforting, but in coping, I altered my diet. So she looked at the aspect of health and wellness.
Yes, definitely. And we're going to talk a little bit about that later on too. But I like the point because many times people experience mental health symptoms and they are concerned that if they share it, they will be doomed to be on psychiatric medication. And the stigma of mental health issues is still real. We joked about it a little while ago where we were talking about MAD and so on. But it is still real. That stigma of having mental health symptoms, the stigma of having to go on psychiatric medication. So to avoid that, a lot of people sometimes just don't share. They don't share what they're experiencing. But I want to reassure that we don't always need to use psychiatric medication. As a matter of fact, less psychiatric medication is best. So anything that can be done to help without using those, what we call psychotropic drugs, that's the preferred way to go. But on the flip side, we also have to recognize that there are times when the psychiatric medication is a must. And we talked about, for example, the psychosis, the break with reality. That is a time where you must use medication to be able to restore your quality of life. But many times, as was shared in the comment, there are things that can be done that do not require the use of drugs. And we're going to be talking about those things in a little while. So I thank the person for that comment, and we would come back to that in a little. Okay? So we talked about loss and losing, and that comment spoke about, the anxiety that was experienced. Another factor that can lead to stress, anxiety, and depression is having to live with pain and other physical symptoms. I think that too is a stressor that is grossly underestimated. We had a person commenting earlier who talked about, I think it was the fatigue and the inability to think that she was experiencing. So pain, fatigue, other physical symptoms can make it very difficult to do things that you once enjoyed. Simply living with pain and symptoms every day can weigh you down. And emotionally, this can lead to frustration and feelings of hopelessness. When you feel bad and you have to use all of your energy just to get through the day, what tends to happen is that you pull away from people. You pull away from social activities. And so loneliness and social isolation may also be a part of the whole package because of the way you are trying to cope with pain and physical symptoms.
Dr. Reid,
Yes.
Another lupus patient wrote, "My name is Ryan, but he has lupus. I'm unable to work. My wife does everything for me. I'm afraid that one day my everything will fail." Now you could sense that in what he's saying, you could feel that.
Yes, you can sense the almost helplessness and hopelessness, because what he is seeing is just doom and gloom. He's afraid that his wife is going to have to continue doing everything for him. And I mean, it's very hard to just say to somebody, come on, man, snap out of that, have some hope, because the reality of the situation it is a difficult situation. But in a case like that, and we're going to come to it later, so I'll repeat it later, but I will say it. One needs to now examine what you're experiencing to see whether this is the illness of depression, where you need to get some kind of intervention, whether it's counseling or medication, or whether this is just a reaction to it that has gone out of hand. Whichever way, we have to do an intervention. We're going to talk about that in a little. So thanks for sharing, Ryan. Okay. Now, another trigger, another stressor has to do with just what Ryan shared. Fears and uncertainty about the future. Uncertainty about the future. Having a chronic, unpredictable disease can cause a lot of uncertainty and anxiety. You may wonder, how is this disease going to progress? You may wonder, will you be able to stay independent? And that's what Ryan is talking about. He now has to depend on his wife to do these things for him. And in his mind, he must be wondering, will I ever be able to resume my role as a husband and look after her and look after my family? People might be wondering, how am I going to manage physically? How am I going to manage financially? And then we have the matter of the family, the children. Should I get pregnant? Should I even have children? So there are a lot of things, a lot of uncertainty, a lot of doubt about the future that can come when you are dealing with a chronic medical illness. Now, one source of worry and concern that can progress to anxiety is the whole notion of when you experience physical symptoms. Lupus is considered a great imitator because it mimics the symptoms of so many other illnesses. That can be stressful too, because people with lupus can tend to worry that every symptom they experience in their body is a flare-up or a sign of lupus. And, just now we were talking about the headaches. That could be a neuropsychiatric syndrome. But it was important for me to say, not every headache is a neuropsychiatric symptom, because that is what tends to happen when you become preoccupied with the illness. Every symptom. Am I having a flare-up? Am I going to have a flare-up? Am I becoming ill again? And that is a very stressful way, again, of living life. All right? And what it tends to do is that you go to the doctor often. The doctor is reassuring you, hey, I've done your bloods, I don't see any signs, your ESR is normal, everything seems normal, but you don't believe your doctor because you know how you feel and you know that you are feeling symptoms, but you don't stop to consider that those symptoms may be due to anything else. I used the example just now of Sahara dust. We have a lot of Sahara dust in the atmosphere, and it may cause all kinds of symptoms. And that doesn't necessarily mean that it is a flare-up of your lupus. But if you become preoccupied with your body and physical symptoms, it can interfere with the ability to make plans for the future, right? So that's another point. Now, there were two other points that I put down there, and I must say I'm really, missing here, having, like even a face-to-face session where people could share, because changes in body image. I have not heard a lot of conversation about this matter in persons with lupus. It is an area that, as I said, I haven't heard spoken much about, and I wondered how people manage that. Is it that maybe the rash, the facial rash, or the weight gain associated with the steroid medication, or has your hair been affected? Are there things that happen in the course of this illness that make you begin to feel uncomfortable about your physical appearance, and therefore it affects your self-esteem? I wonder if anybody could help me with that one. Do we have a comment? No? I'm not seeing. All right. Mr. Balvin, is there a comment?
Yes. Yes. I say, hi, I'm Stephanie. I have been diagnosed 30 years. What for loss of appetite? So she has been diagnosed for 30 years. Wow, 30 years with lupus, and she wants to know what's for loss of appetite.
Okay, so Stephanie, is it that your loss of appetite has been persistent for most of the course of your lupus, or is this something more recently? Because loss of appetite can be a symptom of depression, but we would not want to assume that it is depression we're dealing with here. We would, of course, that's not for you to answer now. This is for you to deal with your doctor, because loss of appetite can occur with many conditions that might be related to lupus, that might be related to something else, or that might be psychological. So if you are concerned about it, and especially if your loss of appetite is leading to weight loss, this may be something that you would want to investigate with your physician, okay? We don't want to accept a long-standing symptom if there are signs of negative consequences like weight loss. And remember, not because you're diagnosed with weight loss means that you can't have symptoms of some other illness. So that is something that should be checked out.
Dr. Reid, we do have lupus patients who have suffered hair loss. I remember, well, I won't call a name, but I remember there was one who worked with the public service in the protective services. And she began to lose her hair, and it was so devastating that she cut her hair very, very short.
Yeah.
Because, the whole feeling of, she's not attractive and all of that started to step in.
Yes.
I remember some of them wear wigs.
Mm-hmm.
Okay, someone just shared a story here. Let me see it. She said, I lost my hair earlier, and that was an altering experience.
Yes.
I cut my hair low and rocketed it for over 2 decades. Okay.
Yes.
It's now growing again. Okay, well, this is another one.
Yes.
Right?
Yes.
Who said that? It really takes a toll on your image.
Yes. Mm-hmm. That's correct. And when we don't talk about it, people suffer in silence. How many times do we meet and discuss these things where people can share, my hair loss really interfered with my sense of attractiveness. And sometimes it can be even comforting to hear one person say it, because it's like, oh, you too? I thought I was the only one feeling like that. And there is so much relief in knowing that others have the same experience. And that's the principle of group counseling or group therapy. Others have the same experience. And in sharing the experience, you can also share the ways that you cope, right? And that's what we are going to come to. How do people cope? How does one cope when your self-esteem is challenged by what the changes that are taking place in your body because of this illness? And you cannot begin to deal with it until you acknowledge it. You have to acknowledge that, hey, I feel badly about this. My self-esteem has taken a knock. It's out in the open now. You can do something to deal with it. Wearing a wig isn't a bad thing. If you feel unattractive because your hair has been falling out, maybe in patches, and you get a very nice wig that suits you, that can help you to feel so attractive once again. So that's a very positive intervention that can take away concern, take away sadness before that concern and sadness reaches to anxiety and depression. Follow me?
Yeah. Dr. Reid, I like what you said there. We have lupus patients who are both male and female.
Yes.
And how the both genders approach approach it is it's different. The men will approach the aspect from, oh, they're unable to provide.
Yes.
They don't feel like they provide in the home.
Yes.
And the woman approach it from a similar aspect, but they swing in more the appearance.
Yes.
They're unable to nurture the child properly. It's so vastly different, but yet it still comes down to they want to support the family.
Yes, yes. And you see, that's why there is no one blanket approach to coping. Each person is different. Each personal experience is unique. And you are just pointing out the various gender roles, right? So our gender roles are still very relevant in our society. And when you are impaired in your expected gender role, that's even more stressful. So you pointed out that the males might be more concerned about the ability to provide, while the females might be more concerned about their appearance. So if you have a male and a female patient with lupus and they both lose their hair, the guy might be able to cope and the female might become depressed, because each person has their own individual vulnerability based on gender roles, based on personality, based on past life experience, based on present life experience. So every situation is unique. Every person has a unique experience. All right, so that's why you have to kind of personalize this. And even in helping people, you have to take into account people's individual situations. Now, one of the other challenges has to do, and again, we began talking about it already, difficulty with family relationships. Having a chronic illness like lupus, we've heard already, it can make it difficult to take care of your family, and you begin to feel as if, you're less of a man, or you are less attractive as a woman, right? But in the introductory video that was shown, one of the persons commented on the fact that I think she said this is an illness that you cannot see. So lupus can sometimes be an illness that you cannot see. And when you experience psychiatric symptoms, many times you cannot see. They are invisible symptoms. You know how you feel, but nobody sees how you feel. And unless your family members are educated about this whole thing and willing to be absolutely there for you and responsive to your needs, you may find yourself in a situation where your family does not understand what you are going through. And your family cannot understand why you can no longer do the things you used to do. So they may think, but you're looking okay. Why you can't get up and cook? Why you can't do this? Why you can't do that? And it may actually result in family rifts that take away the much needed social support that a person with lupus needs. So when we talk about education, and which is why this is good, this forum is good, these sessions that you're having it's really good, because both the persons who are enduring the illness as well as the loved ones need to understand what is happening and need to understand the challenges and how easy it is to develop mental health symptoms, which only make the situation more difficult to manage. Now, one area that, again, we don't talk about much is intimacy. Intimacy, sometimes the physical symptoms of the illness may actually impact and impair the ability to be intimate. And a spouse can be very sensitive to that. But when this goes on for a very long time, that can become very challenging in a marriage. And it might require the need for somebody to sit and talk and mediate so that a good balance can be struck, so that, that the needs of both parties are met without any one party feeling guilty or dissatisfied. Okay, so there are many things within the context of family relationships that may require addressing, speaking out on, and finding solutions for. Yes.
Dr. Reid, I'm so happy that the men in our lupus group are really being interactive today. I really appreciate that.
Excellent.
One of our men, I know him quite well too. He said that excellent session as usual. I agree, Dr. Reid. I mean, Dr. Reid's sessions are always excellent. So we are very happy just to have her here. He said the physical limitation truly affects me. And so, my muscular inflammation affects even the simple task of lifting a box.
Yes. Yes.
This in turn changes how your family interacting with you. I mean, he's speaking out now, just simply lift a box. I know this guy, he's very muscular, and his inflammation affects him a lot, the lupus.
Yes. Okay. So when we go down to talking about the coping, these are the kinds of things that we want to address, because the muscle weakness is a part of the illness. What can you do? Can you do anything at all? And if you can't, then how do you cope with that? There are no easy answers, no easy answers. We're going to talk a little bit about that in a little while. All right. So okay. Anybody else wants to share about some of the challenges? So it seems by your sharing that I managed to capture, real challenges, real struggles. I want to know, is anybody else or anybody having some other challenge that I have not captured? I just give a little time for anyone to share. Are there challenges you find with your illness, with your medication, with, just the whole idea of living with a chronic medical illness that is unpredictable? Are there any other challenges that you can identify?
Okay.
Nothing.
Here we have an opportunity to interact with Dr. Reid. You can also call in at 393-9950, 393-9950. We can hear your voice. Interact with Dr. Reid directly. And as well, you can send your comments or your questions on YouTube here, and we will read it out aloud. Certainly, we won't call your name, but we read it out aloud.
All right. So let's move on then to coping with all of that. We understand the mental health symptoms that can occur. We understand why they occur. We know that you can have healthy coping and unhealthy coping, although we didn't talk too much about that, but we can cope in a healthy manner or not. The grand finale now is, how does one cope in a healthy way with a chronic disease like lupus? All right. I want to just share this before I invite people to share in the chat or by calling in how they cope, right? When you experience emotions, I think I really took the time to establish that there are normal emotions and there are emotions that you might want to consider doing something to address. So it is important to distinguish between what is a normal emotional response and a response that shows that you are not coping so very well and need to do something about it, and a response that says you have developed a mental illness. Those are three different scenarios. You can have a normal emotional response to all the things we just talked about, or you could have a response that says, you're not coping so well, you need to do something about this, or you could actually be developing a mental illness. What do we look at to differentiate among those three scenarios? Well, first of all, we look at the severity of your symptoms. The severity of the sadness, has it reached the severity of depression? The severity of your concern, has it reached the severity of anxiety? We look at the duration. How long have these symptoms been going on for? Are they short-lived, just a few days, and then, something good happens and you're able to snap out of it? And thirdly, we look at how it affects your functioning, your general functioning. Is your baseline functioning still the same? Or have you noticed that you are functioning much less effectively than you were before? The answers, or looking at those three things, can help you distinguish between whether this is a normal emotional response, a poor coping response, or a mental illness. With a normal emotional response, we said the severity is mild. You feel sad, you feel concerned, the duration is brief, and it doesn't affect your general functioning. So something happens and you feel sad, you feel low for a few days, you feel concerned, maybe for even a week, but you think it through, you move into action, you do something, you're fine again. We don't worry about that. I call that human. I call that normal. That tells me you're not robotic. It tells me you're not suppressing your emotions. If, however, something happens, and the something could be any one of those in those 5 categories we talked about, right? And you experience sadness, you experience concern, but this is lingering. 1 week, 10 days, 2 weeks. 2 weeks have passed, and you're not quite yourself. So while you're not down and out and cannot function, functioning has become a little more difficult. It requires a little more effort. It makes you a little more tired to get from the start of the day to the end of a day. And that's going on for weeks. That tells me you're not coping. There's something you're not coping well with. You're struggling. And if that struggle continues, it can lead to something more serious. So if that is happening, it's time for you to reflect, introspect, and make a conscious decision as to how you will cope. Remember our definition of coping for this session, where you make a conscious decision as to how you are going to resolve these emotional experiences that you're having. That you could do on your own. Sometimes it helps to talk to a professional who could guide you through the coping. Now, at the other end of the spectrum is where the symptoms you develop are severe. Severe sadness to the point where, like I said before, can't sleep, can't eat, even having suicidal thoughts. Suicidal thoughts are never to be ignored. Or maybe your anxiety is so intense that panic attacks wake you up in the middle of the night, or you're scared to go out the house for fear of having a panic attack. Those are severe symptoms. And if those severe symptoms impair your general functioning to the extent that your baseline is significantly lowered and it's going on for weeks, you do need a mental health consultation. Don't put it off. It is better to be safe than sorry. Go talk to a counselor, go talk to a psychiatrist. Let that person say to you, you know what? No, this is nothing. Just beef up your coping a little bit and you will be fine. Better to hear that than to miss the diagnosis of depression or an anxiety disorder and have it not treated and worsen, which can only make your whole situation worse. Okay? Clifford,
Yes.
am I question there? Yes.
Yes, yeah. Dr. Reid, I like your last comment because, sometimes you listen to people who may not be qualified to say, to evaluate you, and they may say something that is really hurtful, and you go away with it. But I like the comment you said, let the person really evaluate you properly, because that is important. One of our Lupus guys, he says usefulness kicks in a big way. He's expressing his emotions there. The challenge is balancing how do I exist where I feel I'm not a burden and living in the daily lie of being pain-free.
Yeah. I like that. Let me see if I heard it correctly. Living in the daily lie that I am pain-free.
Yeah, hold on. Let me go again. It says uselessness kicks in a big way. The challenge is balancing how do I exist where I feel I'm not a burden and living in the daily lie, L-I-E, of being pain-free.
Yeah. Okay. So I'm not going to address that directly now. I'm going to run through 7 tips for healthy coping. And I want that gentleman to tell me at the end if he found an answer in these 7 tips. And if he didn't, then I'm going to have to answer the question directly.
Okay.
So let's run with these 7 tips now. I think that's the last slide. Number 1, knowledge is power. Sessions like these are important because knowledge is power. So one step to healthy coping is to educate yourself about the illness. Ask your doctor questions, get adequate information from reliable sources, and having enough information about your illness and its treatment allows you to contribute to your treatment decisions, which can be very empowering. and gives you back a better sense of being in control. Granted, it doesn't take away your symptoms, but it does give you that sense of empowerment, which can help you from falling into that sense of uselessness that we just heard about, right? But even before you do this, you must accept your illness and its limitations. And that's why I asked for the repeat of that last part of the comment. Rather than living a lie that everything is okay, we don't want to live a lie that everything is okay. Because if you live that lie, then you do nothing to make yourself okay in your current situation. You didn't ask for lupus. You're not to be blamed for lupus, but lupus is now your reality. And if you keep aspiring to be lupus-free or symptom-free, you may actually be hindering yourself from reaching that baseline of coping with your symptoms, while of course working with your physician to be free of symptoms. I hope I've made that point clear. I'm not saying one must settle for symptoms. You want to keep working with your physician to be free of symptoms, but in the meantime, you have to accept this reality so you can work with it. Okay? And I really want to hear from that guy if I'm coming across here as insensitive, right? But to me, accepting the reality is very important. Now, once you accept the reality, you have to become aware of the emotions before you can cope with them. So he has identified his sense of uselessness, and I'm sure that's very frustrating, right? So it's good that he was able to identify it, because that kind of emotional self-awareness is an important part of emotional intelligence. So when you acknowledge that you feel fear, or you feel sadness, or you feel grief, or you feel uselessness, and when you allow yourself to express these normal human emotions in a healthy way, studies have shown that that actually helps. As simple as it sounds, acknowledging the emotions actually helps. You can talk about them, you can express them emotionally, you can record them in a journal, or you can sublimate them, meaning you move your focus from what you're feeling to something that is more pleasurable, more enjoyable, and helps you to kind of like exorcise those negative emotional feelings, right? Thirdly, when you have those feelings now, you can choose how to respond to them. So you can choose to focus on the challenges, stay stuck in those emotions and feel sorry for yourself. You could dwell on the why, you could look at the self-pity, because let's face it, a lot of people do that there. They don't realize they're doing it. But you know, you could stay focused looking at who and what you were and see nothing but doom and gloom in the future. Or you can decide that you will adjust to the situation and you will cope with the changes you experience, even if it's a difficult process. I usually remind people of the Serenity Prayer as a very useful way to do this. And we may be all familiar with it, but I remind you of it. It says, Lord, grant me the serenity to accept the things I cannot change, courage to change the things I can, and wisdom to know the difference. The things you can change, you change. But there are many things with lupus that you cannot change. And when you cannot change things, that's when healthy coping becomes most important. So how can we cope healthily? Let me just give you 3 quick ways as we wind down. Number 1, regular exercise. And that, of course, must be after consultation with your physician, who will take into account any secondary health problems, the degree of your arthritis, whether you have any cardiac disease. You may actually have to consult with a physical therapist in this instance, right? But studies have shown that exercise helps reduce fatigue from lupus and overall fatigue from life stresses. It improves heart function, it improves lung function of the lungs, it can decrease depression and anxiety. And people who exercise report having a better self-image and better coping with stress. There was actually a study that was done where women, this study only had women, engaged in a 12-week aerobic exercise program. And it was found that at the end of the 12 weeks, there was less inflammation, right? Exercise benefited the immune system and it didn't trigger any inflammation even when the individuals were going through a flare-up. So exercise, but remember, activities that are easy on the joints, walking, swimming is good when the beaches reopen, low impact aerobics, yoga, all of those types of exercise that will not challenge your joints, right? They can be beneficial. You can engage in gentle strength training. So we talked about the muscles and the weakness in the muscles. Gentle strength training. Again, talk to your physician first. But there are things that can be done. But be realistic in your expectations. You have to challenge yourself, but be realistic.
Dr.
The
Reid,
second,
sorry to stop you there, but there is somebody who came in the studio itself and they want to interact with us.
Okay, great. All right, you want to do that now?
Yes, quickly.
Or you want me to finish? Okay.
Oh, they just left. Sorry. You can go right ahead.
All right. If they come back in, or we could invite them to come back in, that would be nice, right?
Yes.
Okay. So we're talking about coping, right? So we talked about exercise, meditation. Meditation techniques are very useful, whether we do mindfulness meditation or prayerful meditation. There is actually neural evidence that mindfulness helps to control negative feelings. We want to feel better in spite of. Meditation helps. Gratitude. People who regularly express gratitude for the positive things in their lives, whether it's tangible or intangible, they tend to have lower rates of stress and depression. And there are things we can be thankful for, even with a chronic illness, even during a pandemic. We just have to find them and give thanks for them. And just that switch in focus, by focusing on what is good that you could give thanks for, rather than what I've lost, can improve your quality of life. There was a study that was done. They were looking at COVID-19, and they concluded that cultivating an attitude of mature gratitude through actions of kindness, expressing being thankful for life, and enjoying all the small things in life helps in coping with the current threats of COVID-19 and building lifelong resilience for the future. They were looking at COVID-19, it can apply to chronic medical illnesses. Quickly moving ahead, because my eye is on the time. Mr. Bagaman, what time we stop?
Well, we can, next 7 minutes.
All right, okay, great. Let me speed.
Yeah.
General self-care. General self-care is important. Take care of yourself. And that includes being compliant with your doctor's visits and your treatment plans. Choose what you eat. A healthy diet, high in vegetables, fats, and whole grains, that's associated with a higher quality of life. It reduces the risk of cardiac complications. It helps to keep your weight down, your blood pressure, and your cholesterol under control. Now, when we talk about general self-care, in this time of COVID, people are using a lot of immune boosters like echinacea and elderberry. Be aware, I'm sure you are, but I'm reminding you that these over-the-counter supplements that might boost the immune system to protect from COVID can actually worsen autoimmune diseases. So be careful with the over-the-counter stuff. Consult your doctor before use. Avoiding sunlight. Oh yes, I know you know that one. And sleep. When we talk about self-care, sleep. Now, I read a study. They looked at persons who suffer from lupus, and 61% claimed that they did not feel refreshed after a night of sleep. There were many sleep problems, trouble falling asleep, trouble staying asleep, poor quality sleep, a lot of sleep problems. But adequate restful sleep is really important to avoid fatigue and the brain fog that we were talking about. Now, exercise helps sleep. And sometimes you may want to practice good sleep hygiene. So I don't have the time to go into that. Google it, sleep hygiene. And there are some very useful tips as to how you can promote good sleep without the use of pills. Melatonin, not recommended. The studies are divided. Some say it's okay, but most say that's not to be used if you have lupus. So don't go with melatonin. Have emotional support, that's important. Choose the people you keep around you. You want those who uplift you, those who encourage you, not those who put you down. If the ones putting you down happen to be your spouse or people close to you, you may need a mediator, you may need some counseling. And wherever you can help others, you are uniquely qualified to help others with the same experience in a way that no trained professional without the experience can do. And you don't have to be a people person to help. You could participate in online groups. You could share. Even in sessions like these, you could share. So there are many ways to encourage and help others. Last two tips. Seek help. We talked about that before. If you are not coping, do not be afraid to seek help. What are some warning signs? If you find yourself blaming yourself or others all the time. If you continue to be in denial or you're pushing people away. If your sadness and your concern become depression and anxiety, if you're suicidal, you're drinking too much to cope, there are professionals who can help you. And finally, we live in a society that's very religious, all right? There is nothing that helps you to cope better than trusting in your higher power. Have faith and trust in a divine God who can do all things, who can do miracles to help you to cope with what must be a very difficult situation. So after my speeding through towards the end there, I end my presentation and I hope that Mr. Balgobin will indulge us for the next few minutes if there are any final questions or comments.
Well, Dr. Reid, you sped through, but your speeding wasn't above 100 kilometers per hour. It was just good.
All right.
Okay. The young man who keep saying his remarks, he says, I do understand what you are saying, Doc. I often behave because I want to lessen the hurt and worry my loved ones have. I believe I take it to the extreme where I live as if I'm paid free. Yeah. He says thank you for your kind words and the recommendations. He really appreciates it.
Okay, all right. And you know, that touches me because I appreciate his desire to be kind to his loved ones, right?
Yes.
But remember, your loved ones want to be supportive of you too. And when they understand, you all can meet each other halfway. That could be very useful. Okay?
Yes.
All right. Okay. So
there's a comment here from our doctor, Dr. Sweet, because she's a dermatologist. She says, as a doctor, I appreciate that the scars of facial rash can be very deforming. I have seen several patients who are very confident when they are able to adequately camouflage their scars.
Right. You see, and I like that because there are things that can be done. So somebody might have deforming scars and they sit at home and they're getting increasingly anxious and depressed because they're concerned about the scars. They don't want to go out. They deprive themselves of social interactions when they can actually camouflage and feel good about themselves again. So thank you very much, Dr. Sweet, for that comment. And it reinforces that while the challenge is there to cope with everything that lupus brings, sometimes there are things that can be done.
Yes. And Dr. Sweet, I want to read one more last comment, and I'll bring in Dr. Sweet as well if she has any closing comments. This one of them says, I was so stressed I was not able to function. I would go to work, but the energy was not there. I was staying home more and I was sad more frequently.
Yes.
I eventually seek professional help. So she is agreeing with you that she sought professional help.
Yes.
She says she makes some adjustments, it changes.
Yes.
Some of the adjustments it changes I did was to change my working hours.
Right.
Work for specific days so I can rest on other days.
Excellent.
Yeah. So these are some of the comments.
Yes. Thank you for sharing that because you are now reinforcing that it can be done. And that's an encouragement for others who may be listening. So thank you.
I'm going to add Dr. Sweet back into our discussion.
Yeah, just to say, I mean, this has been a wonderful lecture. And I have seen the gamut. I have seen as I said, I mentioned the thing about scarring, the hair loss patients, needing to wear a wig. I have seen patients who don't have the empathy of their employers when they're that is a serious issue. Their colleagues and their employers don't understand that there's some days when, I'm just not going to be as good as I should be. The support of family members important. I have seen splits, divorces, that sort of thing when they don't get the support that they need. You mentioned the whole issue of the mental issues related to the disease per se versus the drug, the side effect of the drug. And I've seen that as well. The so-called what we used to call a lupus psychosis, where the patient is entirely mentally unwell with mania or depression, and you're not sure what you're dealing with. Is it the drug or is it the disease? That kind of thing. So these are real things that lupus patients deal with, and I think you've done a lot today to help to clear up some of the issues surrounding mental health and lupus. And just to mention again the issue of COVID and lupus, and I'm sure that Dr. Tilak Singh would have dealt with this. Patients are still calling and asking me, doctor, is it okay for me to take the vaccine? So I am just going to use this forum to reinforce that you should take the vaccine, and the reason being that you are indeed more susceptible to the effects of COVID-19 if you should get it, and you should take it. Being on an immunosuppressant does not contraindicate you from taking the vaccine. You should take it because you are indeed in a risk group.
Thank you very much, Dr. Sweet, for clearing that up, because many of our lupus patients asking that. And I think 2 of them took the double dose already, double doses, and they were asking about that. Thank you for clearing that up. Well, we've come to the end of our session for today. Thank you very much, Dr. Sweet, for being with us. Thank you very much, Dr. Reid. I just want to echo the exact words that Dr. Sweet says. It's a gamut of information. I tell you, it really is. Ladies, do have a wonderful evening. And I hope that the lupus patients who heard and who got this great information, the video will be posted on YouTube so they could review it over and over and over like a textbook, so you can learn, right? Because these are very, very important information that Dr. Reid has shared. Have a pleasant Sunday evening, everybody. And remember, you're a lupus patient, but you are still normal. You're not different. You're not weird. You are still normal. You can still have a good
And you're definitely not mad.
And you're not mad. Thank you very much for clearing that up. Have a wonderful evening. And we leave you with a song of encouragement.
Like a small boat on the ocean, sending big waves into motion. Like how a single word open. I might only have one match, but I can make an explosion. And all those things I didn't say were wrecking balls inside my brain. I will scream loud tonight. Can you hear my voice this time? This is my fight song. Take back my life song. Prove I'm alright song. My power's turned on. Starting right now. I'll be strong. I'll play my fight song. And I don't really care if nobody else believes, 'cause I've still got a lot of fight left in me. Losing friends and I'm chasing sleep. Everybody's worried about me. In too deep. I say I'm in too deep. And it's been 2 years. I miss my home, but there's a fire burning in my bones. I still believe. Yeah, I still believe. And all those things I didn't say were wrecking balls inside my brain. I will scream loud tonight. Can you hear my voice this time? This is my fight song. Take back my life song. Prove I'm alright song. on the ocean, sending big waves into motion. Like how a single word can make a heart open. I might only have one match, but I can make an explosion. This is my fight song. Take back my life.